Thank you for the introduction. Today, I will be presenting on a 3D deep learning method for cone beam CT reconstruction. And we want to use uncertainty information from both the data and the model to improve the method generalizability and robustness. First, I would like to thank the iStar Lab, the Carnegie Center, our clinical and industrial collaborators, as well as funding support. So cone beam CT systems has seen increasing use in the operating room for image-guided interventions. And the systems like the OARM shown here is currently used in neurosurgical guidance to enable 3D navigation and also to guide placement of neural implants. And these systems has been shown to reduce procedural time, but has a lack of soft tissue visibility, as the example shown here. This challenges the deformable restoration to pre-op MRI and also detection of potential complications such as hematoma, which are often discovered in post-operative imaging. And therefore, we want to have a high degree of image uniformity and soft tissue contrast resolution for this kind of clinical tasks. And artifact correction methods such as scatter, beam hardening, detector lag, and glare corrections has been developed over the years to try to reduce the image biases, but it could lead to amplification in image noise. And fast image reconstruction methods such as FVP is widely used in the operating room, but it's sensitive to noise. Model-based iterative reconstruction methods can provide improved resolution, noise resolution trade-off, and also contrast to noise ratio, but can be time-consuming and limited by the underlying physics model. Learning-based methods open up new opportunities to improve image quality in a timely manner, but it often requires a large set of training data to ensure generalizability. And therefore, in this work, we want to present a DL-Recon method, which reduces biases and noise, and at the same time incorporates the physics model based on the uncertainty information to promote the method generalizability and robustness, and also to offer data fidelity. Here's an overview of the DL-Recon method. First, we perform a standard FVP reconstruction to obtain an uncorrected FVP volume. Then we fed this volume into a 3D image synthesis network and to generate a synthetic CT image, as well as the epistemic uncertainty volume. We also estimate aleatoric uncertainty during the training process and incorporate it into the synthesis training to improve method performance. And in a couple of slides, I'm gonna give a detailed description of these two uncertainties. So please bear with me for a moment. So in addition to the image synthesis, we also use physics-based artifact correction methods and 3D reconstruction to get a fully corrected FVP. And this is kind of our physics-based reconstruction method, physics-based reconstruction. And we then merge the corrected FVP with the synthetic CT using the epistemic uncertainty as a voxelwise weighting to generate a final DL-Recon image. So to train and test the synthesis network, we use a high fidelity forward projector, which simulates realistic cone beam CT from CT. This forward projector models the entire cone beam CT image formation process, including X-ray scatter, spectral effects, detector lag and glare, and quantum and electronic noise. And to further evaluate the method performance, we conducted also cadaver study and clinical pilot study to using the OARM system, as shown here, which features a X-ray source and a flat panel detector within this O-shaped gantry. So for image synthesis, we develop a 3D conditional GAN where the generator is a 3D UNet with residual blocks at each level of the encoding and decoding path. The network takes in a 3D uncorrected FVP volume extracts 3D patches from this volume, and then aggregates all the patches at the end to form a synthetic CT volume. The objective of this CGAN contains two terms. One is the CGAN loss, which compares the input, the ground truth, and the synthetic image. The other one is the L1 loss, which brings the synthetic image closer to the ground truth and at the same time encourage less blurring. We also wanted to estimate the epistemic uncertainty of this synthesis. And this is the uncertainty that is due to the limitations in our training data. So say if we have a test data that has a structure or feature that does not include it, that has not been seen in our training data, then the epistemic uncertainty will be high. We follow the work by Gao et al. And apply dropout layers in both the training and testing stage. And the epistemic uncertainty is computed as the predictive variance from a number of inference outputs, where 50 inference outputs are used in this work. And we also want to estimate the aleatoric uncertainty. And this is the uncertainty that due to inherent noise in the training data. And unlike the epistemic uncertainty, it cannot be reduced by adding more training data. So if we look at the example here, compared to the epistemic uncertainty, the aleatoric uncertainty is generally high in the tissue boundaries. And we follow the work by Kendall and Gao to estimate the aleatoric uncertainty by replacing the L1 loss in this objective function with the Bayesian NN loss, which is the one shown here. And we have the aleatoric uncertainty, sigma A actually squared, but this equation is correct. So we estimate this sigma A by adding an additional channel to our generator for the prediction. And unlike the epistemic uncertainty, which requires a number of inference outputs, the aleatoric uncertainty can be estimated in real time and incorporate into the loss function as a learned loss attenuation. So here we weight the absolute difference between the synthetic image to the ground truth with the 1 over the sigma A. And this kind of enforces that the inputs with high aleatoric uncertainty will have a smaller effect on our loss function. And we call this modified version of network the BCGAN. And we hypothesize that this BCGAN could have improved performance against noisy data. So we trained both CGAN and BCGAN with 20 paired CT and cone beam CT images mimics the OAM projections at various kV and MA, and it's reconstructed with FEP at 0.7 millimeter voxel spacing. The intensity of the input image are stretched within the brain parenchyma region and compressed in the bone region before normalization, because we care more about the soft tissue within the bone parenchyma, within the brain. We trained the network with 3D patches that's sampled from the brain region, and we use an atom optimizer and a dropout rate of 0.2 for the training. Both CGAN and BCGAN were trained for 800 epochs to reach a similar level of validation loss. So as a sanity check, we tested our trained BCGAN network using simulated cone beam CT data at various dose levels. And this is the resulting synthetic image and aleatoric uncertainty map estimated at 36 MAS and 330 MAS. And we can see that the synthesis performance improved a little bit by showing more detailed structures in the higher dose. And also the aleatoric uncertainty is generally lower. And here we plot the mean and standard error of the aleatoric uncertainty as a function of MAS. So the aleatoric uncertainty is measured within the brain region. And we see that as the MAS increases, it decreases. So that agrees with our expectation. Next, we show the synthesis performance of CGAN and BCGAN in simulated cone beam CT test data. So here's one example. This plot summarizes the intensity difference between uncorrected FVP and the ground truth, and as well as the intensity difference between synthesis image to a ground truth in 10 test image volumes. And we see that the uncorrected FVP has intensity difference ranging from negative 100 to 100 house view unit. And this is kind of the input to the network. And both BCGAN and CGAN were able to reduce this difference to have a median less than 1 house view unit and an interquartile range less than 10. But if we take a closer look at the BCGAN synthesis results, we see that it actually provides a slightly more conspicuous anatomical features compared to the CGAN. And this also closely resembles the ground truth. Here's another example in the sagittal slides. And we attribute this performance gain to the use of aleatoric uncertainty in the loss function of BCGAN. But what's really interesting about the BCGAN is that if we look at the epistemic uncertainty that's estimated for this synthesis, then we see that BCGAN was able to provide a very clean delineation of the anatomical features than the CGAN. So these anatomical features are the lateral ventricles and also some cell size around the brain. And these are the features that we think that are highly variable from person to person. And it's also more subject to synthesis error. And we did not stop with simulated data. So we also have real cadaver data where it has anatomical abnormalities that are not seen in the training data. So these abnormalities are like the calcium deposit, also brain shift and blood vessels and coagulations. So in all three cases, we can see that the aleatoric, the epistemic uncertainty accurately highlight those regions in the brain. So far, I have not shown any thing other than synthesis or epistemic or aleatoric uncertainty. But here I want to present you with a very fast and simple or basic form of DL-Recon, where we integrate this synthesis image with a fully corrected FVP. We convert the epistemic uncertainty to a beta map, which has values ranging from 0 to 1, using this sigmoid function here. And when the uncertainty is high, we draw more contribution from the physics-based fully corrected FVP image. And when the uncertainty is low, we trust our synthesis image and we draw from it. Here we show the DL-Recon method for a cadaver data, where we measure the non-uniformity and noise within the brain region, and as well as the contrast at the lateral ventricle. And we see that for fully corrected FVP, it was able to reduce the non-uniformity, but still show a similar level of noise. The DL-Recon was able to substantially reduce the non-uniformity and the image noise, and at the same time maintain the contrast level of the lateral ventricle. As you see that the values are closely, it's very similar to the MDCT. Next, we try out a clinical data by translating DL-Recon to this case, where we acquired the image from a patient receiving SEEG electrode placement at the Johns Hopkins Hospital. We see that this case is quite challenging because of the substantial amount of instrumentation presented in the image, including the electrodes, there's a screw, and also surgical coils and clips. Again, we see that the DL-Recon was able to provide a image with improved uniformity and noise compared to the fully corrected FVP, even in the presence of electrodes, which we don't have in the training data. So in conclusion, we presented a DL-Recon method that combines synthesis image to the physics-based reconstruction. we use both epistemic uncertainty and aleatoric uncertainty to improve the method generalizability and also ensure and robustness to noisy data. In the future, we would like to continue our translation of the DL-Recon method to clinical data with metal and real pathologies. And that's the end of my talk, and thank you for your attention.
Yeah, really nice work. I think you alluded to this a little bit, but with the aleatoric uncertainty maps, so you said it highlighted some of the anatomical differences between patients, but it was really striking to me the pathology really stood out as well in those maps. So do you think they could ultimately be used to highlight, pathology to the clinician and just almost, help interpret the images that way?
Yeah, I think that's thank you for the question. Yeah, I think that's definitely one of the potential applications. There are networks that learn abnormalities in I guess the deep learning methods. Basically, we train with healthy patient data, and then we apply this kind of encoder to like data with pathology, and that highlights. I think this is kind of in a similar idea. So yeah, I think definitely that's a potential application.
Thanks.
Thank you.
Really fantastic work. I had a question about the aleatoric uncertainty. As I understand it, that's the irreducible error. And should that mostly be coming from quantum noise and electronic noise?
So thank you for the question, Matt. So aleatoric uncertainty, when you say it's reducible, I guess you mean like if we have a less noisy input, then.
I mean that through more and more modeling, you couldn't get rid of it.
Yeah, because that's the kind of the inherent noise in our input data. So
yeah.
So we assume that the aleatoric uncertainty is kind of heteroscedastic. So it varies more with like noisy inputs. So it's kind of some characteristic we learn from the input image. So yeah, I think quantum and electronic noise kind of comes into part of it. Yeah, it helps the image quality.
The question I had, the maps, the aleatoric uncertainty maps, looked like there was a lot of uncertainty in the ventricles. And I was wondering, I was trying to figure out why that kind of fundamental aleatoric uncertainty would be higher in the ventricular region versus like the rest of the brain.
Yeah, I think I could go back, but I wanted to say that I think we see aleatoric uncertainty high in mostly the tissue boundaries and also some background parenchyma where there's noise. I think it kind of highlights the region where there's two signals and you try to distinguish between those two signals. And I think ventricle contrast and the brain parenchyma kind of surface is kind of one of those signal separation. So that's why aleatoric uncertainty is also high.
Okay, thanks very much.
Thank you.
Thank you. Very nice talk. I have two questions. The first is, I see your input to the network is uncorrected FPP. What's the motivation of using an uncorrected versus using a corrected FPP?
Yeah, I thank you for the question. I think we can definitely change the input to correct the FPP, like the fully corrected FPP we have. But we kind of want to exercise the network a little bit by not just making it a kind of noise reduction network. And at the same time, when you say, well, we need like a corrected FPP, so what kind of correction are you talking about? And some of those corrections takes maybe another reconstruction or some estimation. So that comes in at the cost of time on also some kind of model. So I think here we kind of try to keep it simple by just using an uncorrected FPP, and we kind of show that it also works in a good way. So
okay. Another is more like a comments. I see your different results kind of smooth out the noise and also the structures a little bit. Is it because you are adding independent noise in your CBCT and the MDCT? Like the noise processes, they are totally different random seeds.
I think maybe this goes into a bit too much detail, and we're running a bit late, so maybe you can
Yeah, we can
continue
talk
this
offline.
discussion during lunchtime. So let's thank the speaker again.
Thank you.